going to lay on top of it. How many layers do we want?
8.
So I would start with 8, remember what we said, because now we have body weight going down on it. So it's going to compress it. The heat will probably come through a little bit faster and a little bit stronger. So I could ask him now, go ahead and lift your head up for me. And go ahead and relax. Go ahead. And now in order to get it to come around, probably need to even be a little bit lower. Lift your shoulders up a little bit. All right, there we go. Now to get it to come around in this position, we're going to need to use our Velcro strap. But be careful that it's not strapped right across somebody's throat. Okay, that's going to be at the very least very uncomfortable. Okay. And then you would go through the same process, check the skin in 5 minutes. Now his bell can be by either hand. So put your bell down here by your left hand. Can you reach it? Okay, so he should be able to do that without having to get up and look for it. And then he could be prone, and then that would look very similar to sitting forward over the table. Question?
For checking the skin in this position, would you just have them either like lift up or
Just
kind of
lift their
rotate?
head a little bit, right?
Okay.
Or, you know, if it's more comfortable, if they roll a little bit, whatever works for them. Okay. Other questions? Is it feeling warm?
Yeah.
You want to stay there for the next half hour? All right. Is your bra strapped down?
Yes.
Okay. Can I put the hot pack over the gown? Is she going home? Is she going home in the gown?
No.
No. So it depends. If she's going to stay in a gown for whatever treatment afterwards, exercise, then no, because I don't want her walking around the clinic in a wet gown. But if she's only putting the gown on for the hot pack and then going to put her clothes on, you can put the hot pack over the gown. Otherwise, we have to take her arm out, like I showed you when we were looking at draping. Remember that? Okay, so go ahead and pull your left arm out. Okay. And tie it back up. But yeah, you don't want people to have wet clothes, especially like these days, go outside, it's cold out there. You don't want to be cold. Maybe in the summer they'll say, yeah, I've wet my clothes, I feel great when I go outside, I don't know. Okay. So if we're going to do a shoulder, she's got a necklace on, may want to have her take it off, but make sure that the hot pack isn't going to touch it. Okay? So probably we're okay. It's not touching it. But this is how you would drape cervical, get anterior, superior, posterior shoulder. What you do have to be careful of is because the top of the shoulder is more bony than the sides. So that's the part you really want to pay attention to when you're checking after your 5 minutes, when you're checking at the end. That's going to tend to be redder and get hotter faster. So make sure you stay within the guidelines of that good moderate warmth. And even if they say, well, it just feels a little bit hot right on the top, okay, then add a towel. All right, procedure the same. Questions? And she could be laying down for the shoulder too. What changes when she's laying down with it over her shoulder like this?
She's not putting pressure on the heat. When
She is or she isn't?
when she's sitting like that, she's not.
When she's laying down?
It's going to be primarily on the back
Okay,
side.
so we have pressure on the back side but not on the front side. So she's probably then going to feel a difference in the heating effect. Okay, Now, if we had somebody where we were specifically, as opposed to the joint, just working on anterior or posterior capsule, then we could use a smaller hot pack and just cover that part and not have to worry about draping the whole shoulder. Thank you. Okay. All right. So, Amy, why don't you get a low back hot pack ready for Olivia? And does Olivia need to put a gown on? All right, so let's all go back and help Amy get her hot pack ready. Okay, so don't ignore and be away from your patient when they're transferring just because you have a hot pack in your hand.
Okay.
Put it. All right, so how are you gonna get her ready now?
Well, first thing, pillow's good. You got it. Okay. So I'm gonna go ahead and untie the bottom strap of the gown.
Okay.
And I'm not assuming, lower the shorts so that her back can be in contact with the hot pack.
Okay, so we're gonna lower the shorts. Anything you're gonna do with the shorts?
Place a towel.
Yeah, just like we did with the massage, and that way it helps keep the shorts from getting wet as well. So make sure you're gonna tell them, you're gonna pull your shorts down a little bit so we
Yes.
can get to the low back and not get your clothes wet.
Yep, so just placing this towel here just to protect your clothing from getting wet, and I'm gonna lower it so that the hot pack can get your lower back, okay? Okay. Good.
Okay, that way then.
Put the hot pack. Or probably offer this first. Is that okay?
You can do that.
Okay. So I'm gonna place this bell right next to your left hand here. Can you make sure you can reach that? Is that possible? Probably not.
Probably not, and most likely she moves her hand, what's gonna happen to it?
It's gonna fall off.
It's gonna fall, so
Where's the
think
good
of
spot?
something better.
Table, good point. Alright, well then, I have this table here to your, right. I had to think about that. Can you make sure you can reach the bell? Perfect. So if you need me, please feel free to ring the bell. So I'm checking your skin. I don't see any open wounds or rashes. Go ahead and place the hot pack.
So I would also tell the patient it's gonna feel a little bit heavy when you have them in this position. And then just, you might have to make sure they have back pain, can you tolerate that? Is that okay? Ask them, the more feedback you get, the better you are. All right, so how long are you gonna set your timer for?
I'm gonna set it 4 or 5 so I can come back and check on her.
Okay. So what are you gonna do in 5 minutes?
What am I gonna do in 5 minutes?
So it's 5 minutes.
Oh, when I'm returning. Okay. Then I come check on her. Alright, Miss Olivares, just came to check. I'm gonna look at your skin just to make sure it's looking good, not irritated, very good. How's the temperature? How would you describe it? Would you say it's mild? Would you say it's strong?
It's mild.
It's mild.
It
Okay.
could be warmer.
Could be warmer? Okay.
Please.
So she's down to 4 layers, but also remember, in reality, she hasn't been there for 5 minutes. Okay. Then she sets her timer. She comes back after how long?
5 minutes.
5 minutes again, because we've changed the setup to make sure that it's okay. Checks the skin, checks it at the end, dries her skin, tells her, it's red, that's normal, and it should go away in 30 to 60 minutes. Questions? See, the doing it part is the easy part. It's all the whys and wherefores and stuff about how it works that is more intense. Okay, so go ahead and you can, well, let's leave you sitting there and we'll just, so we could do in this position. I'd also, if somebody's in prone, you know, see if they want a pillow or, you know, the lumbar pillow under their ankles. Okay. I know for me, this is an uncomfortable position to be laying on the dorsum of my feet. And sometimes patients will say, oh, I'll just scoot down and hang them off the edge. That's okay too. Okay. So we could also do this. What happened here? Oh, that's her shorts. Okay. So we could do this on her thigh as well. So we could put that on her thigh, maybe have her move that leg out to the side a little bit. Thigh. Same thing in supine or even long sitting for thigh or quads or even calf, ankle. Could do long sitting for a low back one as well, you know, pulling this up and having them in a long sitting. That would probably be a little bit better than these types of chairs here. Okay. Process all the same. What I'll do when we're done with demonstrations of everything today is I'll put a list on the board of everything, all the body parts to practice for the different ones, and those are the potential for the lab practical. Okay. All right. Okay. So Pauline and Amy are going to take care of their hot pack nest.